Hi Paula, how are you? You need to unmute yourself.
Good, because I wanted to see how beautiful I look.
You always look beautiful.
How is the background? Let's see.
It's perfect actually.
Is it all right? My books?
Yeah.
I'm in New York.
Wow. It looks nice. Very nice.
It's very complicated, all of this.
I know. So
we have time, right?
Yeah, we have time. It's great that you joined a little earlier. So probably we have another 20-25 minutes.
Good, I'm going to go get a glass of water.
Yes, please. Thank you.
My makeup, I'll be back in a little bit.
Sure.
But where's that? I won't touch anything.
Thanks, bye.
But now I find ourselves, talking to people more, seeing others, meeting others much more than we would have.
So true. So true. We've been doing town halls with the whole staff. We get over 1,000 people are on the call all at one time. And it's a good event that way,
I guess so. So we're learning.
Yes, I think we all are learning. And it's changed the way we work forever, no question.
I guess so, yeah.
I was saying to Dr. Anupam, we have all that office space sitting empty. Because we're not going in, obviously. No one's going in, just a few staff.
True. How are you, Anupam? How are things?
All good. Delhi spiking again, Ms. Preeta.
I heard because there's some friends of ours who've...
Yeah, we've been struggling today to get about 8-9 patients in. So it's gone through that cycle again. So I guess it's the next 4-5 days we'll really have to up the capacity again. We thought it was behind us, but not really.
Today's newspaper said that some tribe in the Andamans, and there are, how do you say that? These are tribes who, they're like protected, like this thing who might become extinct.
Right.
And very small number, but 5 people infected there and admitted into hospital. So it's reaching all over. Nilgiris has 50 in one location, so it's all over the place.
Absolutely.
Well, hopefully there'll be a vaccine. But yesterday I was on a very interesting call with Bloomberg, then the Harvard School of Public Health, and a whole bunch of people. And the big question which we all had, it's like a little working group. How does one, even if the vaccine comes, how do you really produce and implement vaccination? That itself will take a long time.
Yes. And we haven't even really started that conversation.
Anupam, you must be hearing all these debates too.
Absolutely. It's going to be very tricky on 2 or 3 counts. The first thing is, by the time we get the phase 3 data out, the stage 3 data, till that comes out, nobody is really going to be convinced about using it because, there has been paralysis due to the polio vaccine. Influenza vaccine has caused more illness than the influenza itself. So obviously there are these historical data points that worry everyone. So unless we have the stage 3 data to show that this is actually safe. Now, if it is safe, then how durable is the immunity going to be? Because there's just one recent paper that shows that the antibody disappears after a natural infection in 50 days. Now, we know that the immune response is always stronger with a natural infection, and it cannot be comparable to any vaccine-induced immune response. So if it's going to wane in 50 days with a natural infection, how many boosters are you going to need to sustain a antibody level to be able to ward off an infection should an individual get exposed? So that's the second big question. And the third, of course, is how is it ever going to be equitable? Because, obviously it's going to be prioritized and it'll go to some people. And then in large countries, how do you actually go around giving a vaccine to 135 crore, 1.35 billion people? Also, the other very interesting thing is that never in the history of vaccinology has there been a vaccine that has predominantly been used in adults. Vaccines invariably used in kids and then extrapolated to adults. So how will an adult immune system at age 70 react to a vaccine? It's a pretty untested area. The only vaccine that is given that age is herpes zoster, and in some individuals, the pneumococcal and the influenza vaccine. So there's just so many of these questions, and we all want answers in days. And historically, answers to these questions have taken 5 to 7 years. So really exciting. But the fact that we even have as many candidates as we do, and the fact that 6 in human trials with 3 in stage 3 just goes to prove that obviously our understanding of virology and vaccinology has really improved in the last decade. This was unthinkable 10 years ago. We would have just about got the genome in a few months, which happened in days. So be positive and optimistic.
You have to. Well, the other thing we're here in the States is we have an anti-vaccine population, so that there will be a substantial number. Only 70% of our population gets a flu shot, if I'm not mistaken, and there's a real concern that people just aren't going to. There won't be a rush to get it. They won't get it at all.
And the outbreak we had in New York with measles was, you just drove home that point.
Yes, and some of those have been recent.
Yeah, last year.
So a lot of challenges.
Yeah.
Yes, we have a couple of minutes.
Yeah. Sangeeta on?
Yes, she come and said hello, and she's just going to come back on.
Is it still raining there, Anupam?
Yeah, today was bad. It rained a lot.
We could do with some rains here. So Anupam, there's as we're talking, somebody sent me a message in the Newsweek. There's some hospital rating again, and this Apollo Cancer Hospital has come into that rating, which is pretty good.
Wonderful, congratulations.
Maybe post JCI. That's why I'm saying it, since Paula's on the line.
Wonderful.
Some Newsweek rating.
Good.
Gaurav, so it's, I guess it's 6. You want to
Just going to start.
Gaurav?
Yes, ma'am. We'll just start.
Okay, over to you.
Thank you.
Hello, Dr. Anupam.
Hi, Dr. Kochhar. Thank you so much for joining. It's a privilege to welcome you. Paula, Dr. Kochhar is the...
Yes, of course. Paula, how are you?
Very good to see you. Good to see you again. We go to meetings together at ISPA.
Namaste, Dr. Kochhar. Good to see you.
Namaskar, ma'am.
Thank you for doing this.
No, thank you for this opportunity to make us a part of your celebrations.
Of course.
Good to see you.
So we've got Dr. Kochhar. We can start now, Gaurav.
Yes, sir. Just a minute.
Namaste, everyone. Thank you for joining in. A very warm welcome to all the participants. I'm Monica, your host for the evening. Thank you for joining in today's webinar on Indian healthcare stressed with international patient safety and quality protocols, an insight into 15 years of accreditation in India. Some housekeeping things before we go ahead and start this evening's celebration. Please keep yourself on mute throughout the webinar. Write to us in the chat box or message if you have any questions or comments. Please address your question to the specific speakers if you wish to do so. Kindly put in the speaker's name, give your email ID and the question at the end. If you are short on time, we'll be sending all the answers out to you on the email ID you have mentioned. Stay connected throughout the webinar and please drop your valuable feedback to us on our email ID, which is patientssft@gmail.com. Congratulations to each one of you for your contribution towards making these 15 years successful. On behalf of Apollo Hospitals and our sponsors, Sanofi and Roche, I welcome you all to this webinar on 15 years of accreditation in India. India saw its first healthcare specific accreditation about 15 years ago, with Indraprastha Apollo Hospitals, Delhi being accredited by Joint Commission International, and then we never looked back. NABH was then established to developing an accreditation program for healthcare organizations with the objective of enhancing healthcare delivery system and promoting continuous quality improvement and patient safety in India in 2006. Without further ado, I would like to introduce to you our first speaker for the evening, Dr. Prita Reddy. Dr. Prita Reddy is the Vice Chairperson of Apollo Hospitals Group, Asia's foremost integrated healthcare provider. She is widely recognized for her contributions in making high-quality healthcare accessible to millions across the country. She is known for her support to various entities and industry bodies working for the betterment of India. In addition, Dr. Prita Reddy works with the Government of India to advance policy decisions on healthcare and is also the President of NAT Health. She was the founding member of Quality Council of India, and under her guidance, teams from Apollo Hospitals worked with the Government of India in introducing the NABH accreditation. Ma'am, may I request you to kindly give your opening remarks?
Ma'am, you have to unmute yourself, please.
Please unmute yourself.
Namaste. It's as always a delight to be with everyone who are especially the champions of this quality journey. Paula, the team at JCI and all of you have just become friends and part of the total journey in India. So thank you for your time and effort and everything you all do. Dr. Kochhar, it's so good seeing you. Anupam, Hari, Gaurav, my two sisters, Sangeeta and Sunita. I think all of us are in this journey together. And it's such a delight to be able to celebrate 15 years of accreditation in India. You know, I kind of feel a bit nostalgic. And I remember walking into that office in Chicago because the team in Delhi, Sunita was pushing it really hard, said that we need to do something because the other countries have done it. And in this part of the world, there's nothing. There's no gold standard or accreditation. So anyway, I walked into that lovely office in Oak Brook and I was treated very well, but somehow the gentleman I met felt that, Joint Commission accreditation in India seems like a bit of a tall order. And so he said, are you sure you guys want to do this? Do you understand what it entails? And I said, no, we really want to do it. And we're quite happy to learn, and we're quite happy to take on the challenge, but our country really needs it. And more than anything else, it's not for us to get international patients, because I've been asked this multiple times, but it's because we think that as Indians, our countrymen are entitled to, the highest standards of safety or quality outcomes. So that's what happened. But anyway, I never got a yes or a no. But I got really lucky. At that time, Karen Timmons was my uncle's neighbor in Chicago. So I literally talked to her over the hedge. And I said, I went to your office. She was the CEO at that time.
Right.
And we really want to do this in India because, our chairman has started it, and we keep doing things differently. And we do want to do this. We do want to bring these quality standards to India. So she looked at me and she said, okay, we'll talk. And then invited me to a session which was there in one of the large hotels in Chicago, downtown. I don't remember which hotel. I remember the coffee and donuts very well. But having said that, I think we became friends. And the whole team in that office really wanted to work with us, help us. It wasn't as if it was an audit team at all. It was literally like we were partners in a journey. So I do want to thank all of you, Paula especially, and everybody who was part of that office, because recently we managed it again in Chennai, our newest baby, the Apollo Proton Center, in the middle of the COVID pandemic, in the middle of a crisis where nobody could, get on a flight or travel or do anything. But everything was done virtually. It was done with great intensity, let me tell you, because I was seeing every bit of it. But then we managed that also. So I think it just goes to say that when we all decide to work together, and we know that we're not doing it for ourselves, but it's for the patients who really benefit, I think we always come out successfully and as winners. So everyone, for that, I really want to thank you. 1,033 elements, if I remember right. Maybe it's become more now, but that's what we have, and that's what we did. And Dr. Kochar, I'm so excited you're here, because let me tell you that after that team in Delhi did it, in the Delhi boardroom, the Quality Council of India, I used to be a member at that time, came up and said, we really need to do these standards for our country. So that's how the NABH was born. And, Dr. Gyani played a huge role in it. But it started a quality movement. So, even if it's a small hospital, if it's a rural hospital, and government hospitals now are taking on that journey of NABH. And I think that's been remarkable. And the fact that, now you can't even get empaneled to be paid by any scheme, including Ayushman Bharat in the future, I think has really been path-breaking. So sometimes they say, in history, they talk about before Christ and after Christ. In the Apollo journey, we talk about before JCI and after JCI, and it'll be before NABH and after NABH, because simply, it's there for the patients. It's there to teach us what quality is all about. And for everyone, it's a constant learning. And as we were talking a few minutes ago, I think the international patient safety goals are going to become even more stringent, because I think we've all been through so much these past 6 months. We've learned a lot. And I know Dr. Hari and Anupam and Gaurav and all those teams have constantly produced, there's been Red Book version 1, 2, and 3, and there have been clinical protocols which keep coming out on a weekly basis, just telling people where to focus, where to do, how to measure outcomes, and how to be there on the ground, focused, quicker, smarter, more accurate. So I think it's literally made us run much faster. despite the fact that we can't take a flight and see each other and meet each other, I think we're all working 24/7. There hasn't been a holiday lockdown for us. There's just been a work lockdown, I think, for all healthcare providers. So for all the warriors on this conference, on this webinar, thank you for being part of this journey. And let me say that I sincerely pray that your tribe becomes larger, bigger, stronger, because as we go on and as we see more and more happening, we just have to be able to combat illness in a more stringent and in a more safe manner. So thank you all. I wish this webinar well, and 15 years has been a true pleasure and a delight for me and for the rest of the Apollo family. So God bless and thank you and namaste.
Thank you, ma'am, for this terrific and motivating start. Accreditation is a boon or a bane. People might have mixed views about it, but at the end of the day, everybody agrees that the seal of quality given by an accrediting body makes a whole lot of difference. And one gets that when they meet the tough standards laid by these bodies. To discuss the same, I would like to invite our next speaker for the evening, Dr. K. Hari Prasad. Dr. Hari Prasad is the President of Hospitals Division of Apollo Group of Hospitals. He has an established track record and experience in hospital and healthcare industry. He created a platform and provided the impetus for establishing emergency medicine as a specialty in India and established the first operational health city in Asia, Apollo Health City, Hyderabad. He is also an author and has published his recent book, I Am Possible. Sir, may I please request you to address the gathering?
Yeah, good evening, and can I have the slide on? Good evening. It's a pleasure to be a part of this important event. In a couple of weeks, we'll be celebrating the anniversary of the birth of modern-day healthcare in India. Apollo Hospitals Chennai, which marked the beginning of a new era in healthcare, will be celebrating its anniversary on 18th September. Today, we are celebrating the beginning of the quality journey in healthcare in India. Even in these difficult times, we must celebrate the quality movement as it has brought in a new paradigm in healthcare. It's also important to acknowledge all those involved with quality in healthcare and their immense contribution to patient care. These are unprecedented times where unpredictability is the rule and uncertainty is the regulation. We are in an environment like never before, and no prediction of when it will normalize is right. The pandemic has imposed itself on the healthcare sector in more ways than one. COVID has changed everything, and I believe that a new normal is emerging. Irrespective of the environment around us, patients come with faith and trust in us. It is our primary responsibility to live up to the patient's expectations and provide them with safe health care. When we talk about quality, patient safety is a basic essential, and we have believed for long that our job begins and ends with keeping the patient safe. However, there are other elements which are of equal importance and directly impact patient care. This pandemic has highlighted the importance of healthcare worker safety and environmental safety like never before. These have always been an important part of healthcare quality programs, but never received the importance and attention they truly deserve. I was part of a panel discussion hosted by for the Asia Pacific region this morning, and it was a great learning experience. There was a lot of data and analytics, but what struck me the most was the discussion about transmission of COVID in healthcare, either to patients or to the healthcare workers. Infection rates were far lower in hospitals that were accredited than those which were not accredited. The value of accreditations in healthcare can never be undermined. The importance of quality accreditation can never be a burden, and on the contrary, is of immense value in difficult situations like we are in now. Apollo Proton Center, as Dr. Preeta just said, in Chennai, successfully went through the Joint Commission survey at the height of this pandemic. This bears testimony to the commitment of Apollo hospitals to patient, employee, and environment safety. To conclude, I would like to reiterate the importance of quality accreditation, even in the most challenging situations. COVID or no COVID, quality must be the foundation for any healthcare institution. Thank you very much.
Thank you very much, sir. Apollo Hospital was the first hospital in the country to get accredited, and group achieved many milestones in quality since then. May I now request Dr. Anupam Sibal to kindly address the audience and share his views on the experience of Apollo and future plans. Dr. Sibal is the Group Medical Director at Apollo Hospitals and a pediatrician for more than 20 years. He established the Division of Pediatric Gastroenterology and Hepatology in 1997 at Apollo Hospitals, Delhi. He helped establishing the first successful pediatric transplant program in India in 1998 at Apollo Hospitals, Delhi. He is also the President, Global Association of Physicians of Indian Origin, and also author of the national bestseller, Is Your Child Ready to Face the World? Dr. Sibal, please.
Thank you very much, Monica. Paula, Dr. Kocher, Ms. Preeta Reddy, Ms. Sunita Reddy, Ms. Sangeeta Reddy, Hari, Gaurav, guests from all over the country, members of the Apollo family. Good evening and very good morning to Paula. It's a privilege to be a part of this session, this historic event that we have today, marking 15 years of accreditation. Paula would remember 10 years when we celebrated the 10th anniversary, and Paula came down to Bombay, and we had a wonderful CME and an exchange of ideas in Mumbai. Could I have my slides, please? Are you giving me the slide share, please? Or are you going to put my slides on? Are you going to give me the slides, please?
I'm sorry, sir, just a moment. It's just getting uploaded, sir.
Right. So can we go to slideshow, please? Please go to the slideshow. Right. Could I have the next slide, please? Right. You know, we all want to be safe and we want to keep our possessions safe. And in this endeavor, we make a lot of attempts, and so do organizations. Next, please. There are some organizations that actually go the extra mile. Can we have the next slide, please? This is going to be a very quick presentation, so whoever's moving the slides needs to move them very quickly, please. So different organizations have different strategies. Some, of course, travel the extra mile. Next, please. So we started thinking about patient safety and quality improvement, and how is it that we could make our organization really safe. Could I have the next slide, please?
Anupam, the technology can't keep pace with you, so you'll have to be a little bit here.
So our journey started about 20 years ago, and we started looking at ways and means of, you know, keeping our patients, our staff, our visitors safe. Next, please. So we started looking at certification and we looked at different certification models. And then we looked at ISO and several of our hospitals got ISO accreditation. And then we started looking at accreditation because, ISO after all is not health centric. So we wanted to go in for accreditation that is health centric, and that's how started the journey of accreditation. So we looked internationally, we found that that JCI would fit the bill. I think what I'm going to have to do is can whoever's doing the slide stop, please, and I'll do this myself because this is not working. Yeah, I'm going to do slide myself. Right, thanks. So we decided to look at different accreditation systems, and then we decided to go in for JCI. And Ms. Preeta talked about how the journey started. Apollo Delhi became the first hospital in India and the 6th in Asia to get accredited in 2005. Then came Apollo Chennai, Apollo Hyderabad, and the first JCI accredited stroke program in the world was the Apollo Stroke Program in Hyderabad. Then Ludhiana, Dhaka, the first one in Bangladesh, Bangalore, Calcutta, Mauritius, Ahmedabad, Navi Mumbai, and then of course the first virtually accredited through a new model that JCI has developed a facility in Chennai, the Apollo Proton Center. As Ms. Preeta mentioned, we looked at NABH starting in 2006 when it got established, and we now have 32 NABH accredited hospitals. So what has accreditation done for us? Well, it's definitely made our hospital better. It's made our hospital safer. If you just look at ventilator-associated pneumonia, improvement of 87.6%, decrease in VAP 8.77 episodes per 1,000 ventilator days. If you look at bloodstream infection, decrease 4.14 episodes per 1,000 catheter days, an improvement of close to 90%. Medication errors decreased by 1/3. Patient falls, very dramatic improvement, close to 80%. What it also taught us was that we became closer as a team. We became a more cohesive unit. We realized that if we had to achieve the goal, we were dependent on others because alone you can achieve so little, and it's only together that you can scale greater heights. We then started asking ourselves this question: what about going beyond accreditation? Now, medicine used to be simple, ineffective, and relatively safe. Now it's complex, effective, and potentially dangerous. And this was a statement from the Dean of Guy's in 1999, published in The Lancet. There are 13,600 diagnoses. There are 6,000 procedures, 4,000 surgeries. So there's a lot that's going on in clinical medicine at any given point in time. And if you look at published literature on cardiac disease, 1.3 million papers, diabetes, 770,000 papers, and even Friday the 13th and medical, 18 papers. Now, how do you ensure that the right patient gets the right treatment delivered by the right clinician with the right experience at the right time with the right outcome every time? Now, that's a lot of rights to get right. And that's what we started thinking about. We talked to patients and found out what is it that they would want: excellent clinical outcomes, value for money, service quality. We talked to physicians. Again, they wanted excellent clinical outcomes. They wanted the patient to have a wow, and they wanted a conducive milieu to be able to practice what they had learned. Health insurance companies wanted excellent outcomes. They wanted lower payouts. They wanted retention of their customers. So what was the common thread, the common bond? Clinical outcomes. So we decided to start focusing on clinical outcomes. We developed what we refer to as ACE at 25, Apollo Clinical Excellence 25. Apollo Hospitals Group had turned 25. We developed a clinical balance scorecard, 25 parameters, benchmarks against the world's best published outcomes, all online on the Apollo Lighthouse platform. We looked at published data from top institutions in the world and then arrived at this score. Just to give you an example, CABG, the best mortality figures are from Cleveland, a 99.4% survival. So if our hospital is comparable, they get a score of 4 on 4. But if we lose more than 2%, we get a score of 0. Now, most hospitals be really happy with outcomes of 97.9%, but in Apollo hospitals, you get a 0. Similarly, door to thrombolysis time in stroke in the ER, benchmark with Mass General, 60 minutes. Less than 60 minutes or equal to 60 minutes, score of 4 and 4. More than 90 minutes, score of 0. So each of these scores come into a score of 100. We want each of our hospitals to be more than 75. And I have to say that it's very hard to get to 75 and above every month, because these are really the world's best published benchmarks. We get data. This is data from one of our hospitals every month. We get data from all the hospitals, and this goes to the board. And if a hospital gets into to be furnished. We then went on to develop the Apollo standards of clinical care. So we have ACE1 and ACE2 as the balanced scorecards, the Apollo quality program that looks at handovers between doctors, nurses, nurse, doctor, nurse, nurse. It looks at the Apollo mortality review, the incident reporting system, and critical policies, plans, and procedures and compliance with them. And if we look at how the task scores have gone for different levels of hospitals, you can see consistently we are seeing an improvement. And this is across the group, whether the hospital is rural, small, or in a metro large hospital. COVID really changed things considerably for each one of us. And we then had to start looking at COVID-19 care. So we did that for hospitals, in hotels called iStay, and our homes. Wanted to make sure that the care that is delivered to individuals with COVID-19 is absolutely safe, world-class. And at the same time, we had to open up our hospitals to non-COVID patients and to make sure that they were safe. So we managed to get the balance right, continue providing excellent COVID care, and yet making sure that our facility was safe for non-COVID work. And we did this through the use of protocols, and our clinical protocol, for example, for COVID has gone through its 28th revision. And we have the Red Book, which is in its 10th edition, on how to manage facilities balancing both the requirements. You know, COVID has changed our lives, hasn't it? From online banking to watching Netflix, to online classes for schools, to ordering food online, to shopping, to, of course, meetings like Zoom. In healthcare too, we've seen that Apollo 24/7 consultations, anywhere, anytime, virtual rehab, virtual dietetic consultations, virtual counseling, medicines delivered at the doorstep, diagnostics at home. So as we've gone down this digital transformation, we have reminded ourselves continuously that we need to focus on patient safety, quality improvement, and we need to look at ways on how is it that we can provide care digitally, which is safe and which is built on the principles of continuous quality improvement. Well, many of you would remember Prince. He, of course, sadly passed away. And Prince really shook the world when he decided one day that he would no longer have a name and would be recognized by this symbol. So when the world got to see the symbol, his agents, the press, they were all very surprised. How is it that you identify a human being, and that too a pop star, with a symbol and not a name? So they decided that Prince would have a new name, and they called him the artist formerly known as Prince, or TAFCAP. So Prince started getting referred to as TAFCAP. I think the way medicine is evolving, the way relationships between clinicians, healthcare providers, and patients and their relatives are evolving, we will soon have another term, and it will be called TIFCAP, the individual formerly known as a patient, now a partner. So TIFCAP as a partner, and a happy partner at that. I'm going to stop there. Thank you very much for this opportunity. Over to you, Monica.
Monica, could you please unmute yourself and start?
Thank you very much, sir. So before we move ahead, I would like to request the participants to drop in their specific questions. And if they want to address it to the specific speaker, put in their name, then your email ID and the question. So now let's move the table from hospital's end to the accreditation provider's end, the two large and most reputed accreditation system in the world. I'm very excited to introduce Ms. Paula Wilson as a guest for the session today, and would like to request her to deliver her keynote address on the future plans of JCI in India. Ms. Paula is the President and Chief Executive Officer of Joint Commission Resources and its international branch, Joint Commission International. Ms. Wilson has more than 30 years of experience in the healthcare industry. Most recently, she provided management and strategic planning expertise as a consultant to public, non-profit, and private organizations. She was previously the Vice President for Policy at the United Hospital Fund, leading efforts to shape public policy, changes related to insurance coverage, healthcare financing, and Medicaid. Ms. Wilson, please.
Thank you, Monica. And could you take that slide down so people can see me? And I don't have slides, so it'll just be me. So I am so pleased to join this event today, and I want to thank everyone, Dr. Preeta Reddy, Sangeeta Reddy, Dr. Anapan Sabal, Dr. Hari, it's nice to see you. We had a conversation recently, and seeing you on this call is very good as well. Also, Dr. Kochar and I, who share seats at the table of ISQA, and obviously Gaurav, who's Loria, who's one of our surveyors. I feel very comfortable. I'm with family, friends, longtime friends today, and that's very comforting at a time like this. I was especially pleased we were having this event in the midst of the COVID pandemic. I think when we are able to continue to have education events and celebrations such as this, it speaks to our resilience as human beings, and it also gives me hope for the future that we're all going to come out of this stronger. We're very proud of the work that we've done in India. We've been in India, as we said, for 15 years, starting with the hospital in 2005, Indraprastha Apollo Hospital, 2005. And today we have 31 hospitals in India and 4 ambulatory care centers. And we're very eager to see that number continue to grow. And I'll talk a little bit more about that in a few minutes. But I always like to start a little bit with history when we talk about looking at the future. And really, we're 15 years in India, but globally, accreditation has existed in some form for about 108 years, almost 110 years now. And it started with a surgeon, Ernest Codman, in the United States, and what was to become the American College of Surgery. As surgery developed as a practice, they wanted to know that they had a safe and competent physical place, the hospital itself. They wanted assurances as surgeons that it was safe to do surgery, and how would they know that? And that was the beginning of what we see today. Dr. Codman invented and started with 5 standards and started the on-site surgery. 70 years, and then that grew over years, over many years, until 1951, when the Joint Commission was formed. That's the American company and the part that JCI is a part of. And we will be 70 years old as a company in 2021. Joint Commission International started 20 years ago, so Apollo was within the first 5 years of our beginning. Our first survey was in 1999, and we celebrated our 20th anniversary last year. And 15 years, as I said, in India. So a lot of history there, and it's interesting to look back as we learn from what our history is. But while it's important, the future is also very, very important. And as we think about it, the survey that was done in 1912 versus the survey that was started 70 years ago, the one that we did 20 years ago for the first time, even the survey that we did 15 years ago is very different than the one we do today. But I think that the next 5 years, and next decade especially, things will change an awful lot more than they have in the first 108 years. Over the last 5 months, like so many organizations, hospitals, and otherwise, we've had to pivot very quickly to be able to continue to work during the global pandemic. We were lucky. Because of security issues in different countries where we work, we have experience and a depth of talent working remotely. So this is a period now where we're doing a lot of virtual surveys, like the one we did at the Apollo Proton Cancer Center. We did that in Chennai in July. And by the way, that was a huge benchmark for all of us, for Apollo, for JCI. It was one of the biggest hospitals we've ever done remotely on a virtual basis. It's the only cancer hospital we've ever done like that, and it went really, really, really well. And I'm very, very proud of my team. We're so proud of our relationship with Apollo and how we did that together. And so we know we can do this. We are lucky that we've been able to have that experience, and we were prepared to do that survey, which speaks to the resilience and the flexibility of JCI. We've been very limited, as you know, and everybody has, in terms of doing our normal business. But we're using this time to reflect on how we're doing, what we're doing well, and how do we do better? How do we increase the impact of accreditation on patient safety and quality? We're trying to maintain our workforce as much as possible because we know we're going to go back to work. And so while the surveyors and the consultants have not had a lot of travel time, they've been assigned to all different projects with the central office staff. And so some of the things we've worked on and are having some productivity already. We have a team working on performance measurement, for example. And I think by the end of this year, we will launch a pilot that will allow the internationally accredited hospitals who are using electronic health records and electronic measures. They're going to be able to share the platform that the United States uses for the measurement program here in the US. It's a very, very high level performance measure program. A lot of hospitals like yours are interested in pushing and going further with measurement. A lot of organizations want to be able to compare to other hospitals in their market, as well as hospitals around the world and including the United States. So this time has not been idle for us. We've made some good progress on that. I've had another group working on the network and system certifications and accreditations. And I think we're going to be prepared to deliver some of that in 2021. And I know that's something of interest to Apollo. And then a third team has the assignment of reimagining accreditation, which is kind of everything is on the table. Think about everything, question everything, and how to use technology to make us not only more efficient, but more having a much more rigorous and insightful kind of evaluation. And so that's been a lot of fun. That's going to be an ongoing kind of activity as new things happen at JCI. But we're questioning everything. So why do we have a 3-year cycle? How else can we engage? How could we have a continuous engagement with organizations? How do we make this accreditation process more impactful and less expensive? Because I think that is going to be critical for us from a future perspective, and particularly in places like India where there is a lot of price sensitivity. So all of those things are going on now and keeping us busy. Also looking at how do we think about the electronic health record? How much does that present an opportunity for us in terms of how we do the accreditation? So all of these questions, all of these initiatives, all of these projects, they're going to require some focus and attention. And one thing I wanted to let you know today, and this is not a formal announcement, but kind of I'm giving you a heads up, that beginning in September, we have a new vice president coming on board to be the vice president of Joint Commission International Accreditation. That position's been vacant as we did the search. And so a new physician will be on the team September 14th, and his responsibility will be to drive a lot of the innovation and new things and new projects that we're working on. A formal press release will be available. I'm really not supposed to be talking about it, but we're friends. And I didn't want to leave that out as I spoke to you today. As far as our future in India, and Dr. Anupam Samal and I have talked about this a lot. How do we get bigger in India? I do think it's a challenge for us. And the challenge really is a US-based company with enormous overhead. We're not a small company when you look at the whole thing. And all of that is good. It's part of our strength. On a survey method that requires travel, which is expensive, all of that has limited our growth in a price-sensitive market. But I think that if we think about a completely kind of model and a different way of approaching the country, and maybe we have 2 different kinds of products, that's one of the things we're looking at. But I think that we have the talent within India, certainly within our company and in India, with organizations like Apollo, with organizations like NABH that also have an interest in all of this, that some type of collaborative discussion and some type of sharing of information and learning, I think there is a great, great opportunity for JCI to work and expand its work in India. And I'm optimistic about that because of all of those relationships and friendships that we have and the experience that we've had. But I'm really optimistic because really all of the accreditation models, it doesn't matter who the organization is, the standards, the method, all of that, the single driver that's most important to quality and safety is leadership. And you at Apollo are blessed with an incredible leadership team that drives that drumbeat every day of the importance of the patient and the safety and quality of the care. So I know that you have what we need in order to continue to grow and be a better presence in the healthcare arena in India. So thank you again for inviting me to be a part of this. I'm really, it's just fun, and it's great to see everybody. And I'm looking forward to our continued relationship and conversation. Thank you.
Thank you, Ms. Wilson. NABH is the accreditation system that has elevated the standards of Indian healthcare multifold in last 15 years. The team has tried to achieve that what none could have ever thought of. Dr. Atul Mohan Kochar is the Chief Executive Officer of National Accreditation Board for Hospital and Healthcare Providers. He obtained his MBBS and MD Dermatology from the prestigious Delhi University. Over the years, he has held various organizational positions, namely the President, Secretary, Vice President, the Executive Member of the IADVL Delhi State Branch, and is the recipient of various state and national awards, including the prestigious Sardari Lal Memorial Award for the year 2015. He is the current President, Society for Pediatric Dermatology, and Founder Secretary for Scientific Cosmetology Society. He has more than 70 publications, 4 books, and many chapters and multimedia to his credit. Quality promotion of patient safety and taking best healthcare practices to the poorest of the poor are his missions in life. May I now request Dr. Kochar to please let us know about the future plans of NABH.
Thank you, Monica. Thank you so much, Paula. It's always so insightful listening to your reimagining accreditation, which is such a wonderful concept. Anupam, it's really, it takes me back to MAMSI days to hear you speak in such simple yet effective language. Preeta ma'am, thank you so much once again for giving this opportunity and making making me and NABH part of this entire celebratory process. Just if you'll allow me to share screen, please. Is my screen visible to all?
Yes, doctor.
Thank you so much. So respected seniors and dear friends, at the outset, please allow me on behalf of NABH to salute all of you and the entire Apollo group for dedicated services to the nation. Please accept my heartiest congratulations for successfully completing 15 years of accreditation in India. It pleases me to inform you that on 27th of June this year, NABH also, the foundations of which were laid down by Preeta ma'am, as she said, in that boardroom of Quality Council of India, we have also completed 15 years, and we are also celebrating our 15 years of quality, safety, and wellness. As I see, there are many parallels in this 15-year celebrations for the two organizations. While the Apollo Group pioneered in 1983 and is credited with the first corporate hospital of India, but today they have a robust ecosystem of 74 hospitals, more than 4,000 pharmacies, and hundreds of clinics. NABH, which is currently a teenager now with 15 years of age, started with one program in 2005 and today has 21 broad heading programs categorized into accreditation, certification, and empanelment, with a total basket of 9,600 flourishing partners. I can unhesitatingly tell you that while the Apollo Group has been the cradle of quality in the country, the NABH also has not been far behind. It's been the key agency responsible for kindling the revolution of quality in healthcare in India. Both NABH and Apollo Group have touched the lives of millions of people and both have been built on a very strong foundation, very strong foundation of core values which we respect, like ethics, integrity, honesty, probity, and propriety. Both organizations are homegrown and truly embody the concepts of a self-reliant, Atmanirbhar India. While striving consistently to go beyond accreditation, as Dr. Anupam very rightly pointed out, we all must strive harder to cultivate now a culture of quality. For both NABH and the Apollo Group, the next 15 years are to be about touching the moon. They are to be going forward, touching and reaching out to new frontiers. But we should also think that the next 15 years should be more about being restless, as Paula said, being dynamic, about reimagining healthcare, about thinking of newer options, about the virtual, the remote. And as we are speaking, NABH is carrying on about 9 remote assessments of small and mid-sized hospitals. But it's also going to be not being satisfied by creating islands of excellence. So the next 15 years are obviously about new frontiers such as digital health, for which NABH about 4 months back initiated the standards for digital health with prominent representation for every nodal agency. But these digital health standards, as Anupam said, are to be about content, about the information, as Dr. Hari Prakash also said, about information, about consent, about privacy, security, and interoperability, how the data is going to be stored, shared, and taken forward. So the next 15 years should be about all these things and should be also about taking quality to the grassroots. So we should be talking about creating basic concepts of hand hygiene in India. As Preetham said, that the patient safety goals, the basic concepts of not only hand hygiene, the surgical safety checklist, and the basic essentials which need to be taken to the grassroots. So essentially speaking, taking quality to the last man in the line. So just like we have been talking about the herd immunity concept, we should be talking about creating a culture of quality. We should be talking about herd quality. So my only request is, let's join hand for patient safety. We need to see more of NABH logos on your hospitals. Even when they are JCI, we need to partner with having a collaborative approach, and we need to take forward best wishes and congratulations once again on this momentous occasion. And thank you so much for making NABH part of these celebrations. Thank you so much.
Thank you very much, sir. Patient safety is the most discussed topic in terms of healthcare always. However, on the other side, experience is what the patients see for in addition to safety. Let me invite our next speaker, Mr. Gaurav Lauria, to talk about patient safety and experience in today's time. Mr. Gaurav is the Chief Quality Officer and Head of Operations at Apollo Hospitals. He has over 15 years of experience in hospitals, ambulatory care clinics, healthcare IT, consultancy projects, multi-site management, and has an excellent understanding of the hospital processes. He is also an administrator surveyor with Joint Commission International and a member of expert to review NABH standards, ambulatory care, and CII. He is an author of the book Conditions Applied, beside many other publications. Mr. Gaurav, please.
Good evening, everybody. Patient safety and experience in today's times, I guess the difficult times of the pandemic times, the concept actually that the patients could be harmed while receiving medical care has been known for thousands of years, since Hippocrates coined the phrase "first do no harm." So everybody knew since then that there is going to be a chance of some harm or patient safety issues. And actually the most serious medical errors are committed by competent caring people doing what other competent caring people would do, and then errors do end up happening. But what we can do best is to ensure that our systems are protected to the best degree by ensuring that leadership is involved in it, having a common set of safety metrics which are used to measure the effective outcomes and expected outcomes, addressing the safety across the care continuum, supporting the healthcare workforce, partnering with patients and families for the safest care in a way that even they are equally responsible for this care. For example, that, if we are talking about partnering with patients and their families, it's about how do they feel equally responsible? Do they make an effort in asking what medication is being given to the patient, or what medication, what's the purpose it is for? Knowing and then signing the consent forms and understanding what are they signing up for. Being more proactive and transparent, and, asking questions, getting clarifications, and also informing, their condition and their status as to what is it that's going on with them and what is it that they're seeking for. So besides this, also ensuring that, the technology is safe and it is optimized to improve patient safety at all levels. From an accreditation perspective, however, these complete standards around disaster, epidemic management actually came in very handy in these times. Because, we had the plans, we had the identified resources, our staff has been trained, the different communication strategies that we had laid in place before itself, whether it is about internal communication or external communication, the different isolation strategies, assignment of the staff roles and responsibilities, and also testing the complete system at continuous intervals. So it was not that we had to actually start from a scratch, but then we were almost prepared to deal with such kind of a pandemic. While medical discoveries about COVID-19 treatment drew a lot of media headlines, the quieter systemic innovations focused on creating strategies to keep the workers safe and then, deploying them effectively. Which also included the new ways of creative staffing. How are we cohorting to avoid burnout of the frontline workers, as well as prevent staff infections, and in parallel giving care to the patients that they need, while also preserving the hospital resources. The daily PPE counts, or looking at, using the PPE calculator that we developed, the constant training and supervision in terms of our protocols. And, that had been a new normal for us for almost last 4 or 5 months. As far as patient experience is concerned, we have also started moving from evaluating satisfaction to experience. And most of the times, these two words are used interchangeably by most of the people, and the difference is not well understood by many. Patient satisfaction is most of the time, it's actually a very subjective measure, while experience is more objective. When we take a feedback from patient and ask them, how was your doctor? How was your nurse? Did you get the, was the food okay? Or, was your room cleaned well? The answers to that is more on the subjective terms. And it is generally based on their preference of, what kind of room or what kind of food was given to them. But when we ask them an experience related question and ensure that their, your requirements are fulfilled, then you're actually doing the right thing. It's not about focusing on what did, if they like the nurse or not, but it's about focusing on if the nurse did the right job, what she was expected to do or not. For example, asking patients if their doctors washed their hands before touching them or not, if the nurses identified them before giving medications or not, or if they were given the right information about implants when patients underwent a total knee replacement. And these all things require a lot of change and understanding at the leadership level also, because, we need to be confident enough to go up front and ask these questions to patients and their families so that we continuously correct our processes. And during these times, especially, the one thing that I learned was what I call it as minimal contact operations. That, how do you ensure that you have fulfilled the requirements of safety, preventing infections from a staff, patient, family perspective, as well as you have given a good experience to your patients, and not about satisfaction, but a good experience. How can you shorten or, streamline the processes to reduce the connect points? So for example, if you look at the discharge process, and which is one of the most painful processes for most of the hospitals, it's always, into multiple steps. It takes a lot of time, creates a lot of bad experience in terms of patients, what patients go through. So understanding the whole discharge process, and then, creating systems, getting technology in, going through a lean management process wherein you cut down the steps and you understand how can you improve the whole outcome, making sure that from a safety perspective, the discharge summary that goes out is checked. So, how do we synchronize and how do we shorten this whole process in lines with what are we aiming to achieve or what are we aiming to deliver to our patients? So I think, looking at this whole minimal contact perspective, from the point of cutting down the contact points wherein the staff of the hospital gets in touch with the patient or the family needs to move towards these to the staff where the staff is located in the hospital. By removing all these things, reducing a lot of this stuff, we can improve experience, we can reduce the turnaround times, as well as, we can reduce the chances of infection and create that positivity in the patient's mind that, they are safe, that they can trust the healthcare provider, the brand, and also that they can happily, get well inside the hospital and then, stay safe once they leave the organization. However, life is different today, and we will continue, and it is continuing to be different. We need to continuously adapt ourselves to the environment. Every change in the manner we function will resolve one problem, but it will obviously always present other multiple issues for us. The question that comes is that, is there an end to this? Not exactly. As long as healthcare is human intensive, which it will always remain, errors will remain to happen. Patient safety will continue to be challenged. While what we need is to continuously challenge ourselves and move towards reducing harm. And that is what I think, we have learned for the past 15 years from an accreditation perspective. And that is what we continue to follow and take it forward to move continuously, stepping up and moving to the next levels. Thank you so much for the event, and thanks a lot.
Thank you so much, sir. We have had really many interesting thoughts discussed today by our eminent speakers. Let me take this opportunity to welcome one of the speakers who is always loved by her audience, Dr. Sangeeta Reddy, Joint Managing Director, Apollo Hospitals Group. Dr. Sangeeta is a global healthcare leader, Indian entrepreneur, and humanitarian. She is also the president of Federation of Indian Chambers of Commerce and Industry. She is passionately committed to transforming healthcare system through technological advancements, accelerating positive transformation for effective healthcare service delivery. She has been conferred with an honorary doctorate by Macquarie University, Australia, in recognition of her untiring efforts and resolute commitment to bring transformative changes in healthcare, development of healthcare IT, and championing many-fold initiatives both in India and abroad. Ma'am, may I request you to kindly address the gathering on key fundamentals.
So good evening, good morning to Paula, namaste. Let me begin by congratulating all of you. It's wonderful to see you, people who have been part of the quality journey of Apollo, people who have supported, mentored, and others like Dr. Atul Kochar and many, many others who are committed to the credo of quality in India. Some of you, may have noticed that while the previous speaker was speaking, there was a series of inappropriate interventions happening. And normally we would gloss this over. But I think one of the big things that we learned in the quality journey is that we should always have the courage to call it out. So I'm calling this out and telling all of you that I think that we as a nation who are committed, for whatever reason, Zoom has been having significant problems. And I think we need to find other platforms if this is what happens on a credible paid platform where a qualitative discussion is happening. And we should not keep quiet. So like when we saw that things need to get better in healthcare, need to be standardized in healthcare, we stepped up and said, let's embark on the quality journey. Whether this meant doing the first JCI, which happened so many years ago and has really been such a landmark and such a wonderful journey for us, or it meant working with Indian accreditation bodies. I was part of the team that went to Thailand and we studied their systems. And then we shared all of this, and the first, from Quality Council of India, the first NABH was set up. And I think there's such good memories. So every time a hospital gets NABH or NABL accredited, whether it's an Apollo or not, for me, it's a moment of silent celebration, saying the Indian standard of care is going up. And I want to thank Paula, because seeing, you know, JCI here and seeing all of you here is once again kind of a memory. An anniversary or a celebration is about memories of the past. It's about this present, and at this present moment, I'm totally enjoying working with all of you, and it's about commitments of the future. And looking at memories of the past, I think one of the most significant things has been that we moved from physical infrastructure tracking to process tracking to finally outcome tracking. And this journey happened for us in just, you know, under a decade. And I remember, you know, almost 7-8 years ago when the first time they started patient tracers. So they're going to trace a whole file. Imagine the tension that's going to be. And finally, it became such an important part of the journey. But I'm calling that one out because it lends me to, I think, the most important aspect of the quality journey. And that is that the entire aspect of, is this quality journey working or not, is as strong or as weak as that last individual, one individual. Is it one housekeeping person who didn't swab correctly? Is it one supervisor where the dilution was wrong? Is it one nurse where they loaded the ampule with the wrong dosage? And so every single link in the chain, you know this, you all live it every day. And yet it's a point that has to continuously be reiterated. And in that pursuit, I want to call out or flag out two very important things for the future. And those two are, number one, that the aggressive adoption of information technology and all aspects of technology, whether it means connected rooms where we will get BP and all the vitals monitored and SpO2 automatically entering into the computer so the nurse does not have to do routine work. The ability to automate, then the ability to use artificial intelligence to create algorithms for early warning systems. What happened by intuition and supervision will be enabled greatly by technology, early warning systems, and all kinds of alerts. So the ability to adopt that significantly is one of the big things I really wanted to call out again. And finally, all of you are IT gurus in your own way. All of you are technology gurus, but all of you are mostly great practitioners of the quality journey and quality gurus. I want to add one dimension to the quality journey, which has also been called out before, but at no time has it been as acute as during COVID, and that is public participation. Because when COVID struck us, what happened was not just a significantly impacting lives, but completely destroying livelihoods. What happened was not changing the way we work, but changing the entire work paradigm to work from home, remote care, teleconsults, a complete transformation. And what happened is also that it opened up our minds to the capabilities, the possibilities, and the necessities. And in that, one of the big necessity was communication to public and society about the important role that they played in prevention. Because unless public participated in the lockdown, prevented the early transmission, flattened the curve, our hospitals would have been overwhelmed. As in every quality journey, as in every healthcare journey, the role of public and society, especially in an environment of non-communicable disease and the current aspects of pandemics becoming endemic sometimes, these two are where we need to call upon society and have a deeper and smarter participation of public. And finally, the last point I want to add really is the aspect of, because of this changing world, it is not really the smartest who survive, but the most adaptable. Those who learn to figure out what are the care protocols. The fact that there are 23 or 24 versions of the Red Book, because every day we learned what started off as what was potentially a pulmonary disorder, then became a systemic disorder, was a blood clot, was about cardiac, had neurological implications. And actually it was best not to keep putting people on ventilator and try to manage them on different methodologies. All these evolved. Education became one of the biggest quality journeys. And I want to share with you that in this period of time, not only did we bring in 18 million people, the public, on the COVID risk score, and then triage them into the appropriate care at the appropriate time, manage telemedicine in stay as well as in stay at home, but did a training. And on the basic COVID training program, over 6 lakh individuals took that from all over the world. And finally, we also created a ventilatory training program, which had content, simulation, and in association with the Critical Care Society of India, a buddy system so that there was a one-on-one mentoring for first-time ventilatory use. I think using knowledge, technology, capability systems to apply in healthcare. No time has the world ever done it so well, so fast together as now. Let's all, as healthcare professionals and as people who have dedicated our lives to healthcare, keep up this awareness level about the power and the need of healthcare and the need for collaborative work. I want to end by just thanking all of you for your tremendous commitment to the field of healthcare, to Paula, Dr. Kocher, Anupam, Hadi, all our doctors, nurses, paramedics, quality professionals, every single one of you. Looking to the future, only one thing remains constant, and that is our commitment to patients, to wellness, to keeping people happy, and to all of us staying together as a team, practicing a high standard of care in an environment of respect and mutual understanding, so that the outcome of our work is not just the direct produce of what we get, but a deeper sense of satisfaction of what we are creating. So congratulations to all of you. Stay safe, stay well, stay happy, stay together, and stay committed to this wonderful journey of quality. Namaste and Jai Hind.
Thank you, ma'am, for those inspiring words. Moving towards the last session of today's webinar. Due to paucity of time, we'll be able to take only a few questions. But we promise you, if you have dropped your question with your email ID, we will get back to you with answers very soon. So moving on to the questions. The first question is addressed to Dr. Anupam Sibal. What is the biggest challenge you faced during the first time accreditation cycle for your hospital?
Thank you. Thank you for that question. And as Ms. Preeta said, it was really very exciting for us, because who remembers the second man on Mount Everest? So we were either going to be the first, or we would have attempted something that people would have said was really audacious. So I think that in itself gave us the excitement. And, you know, with our chairman, Dr. Reddy, he's always done things differently. He always pushes the boundaries. When he created the first hospital in '83, everybody said, oh my God. And then from one thing to another, there isn't an aspect of the healthcare landscape that we do not touch. And that's because of the inspiring leader that we have in Dr. Reddy. So he just said something, don't you think it's good for the country and we should do it? And that was it. And the team was energized, 2,000 people. Yes, we'll do it. I think it was all of us coming together with one goal, one mission. And I want to tell you this story because I've said this many times, so I apologize if you heard this before. Paula, you know, the team from JCI was coming in on Saturday. First time coming into India, and we were organizing the pickup from the airport, and Peer Mohammed, who's Dr. Reddy's chauffeur, was assigned the task of going and picking up the surveyors. And, you know, we were doing the last minute touches on Saturday, getting everything ready. And Peer Mohammed came to us, and we were all obviously very anxious. And Peer Mohammed came up to us, and Peer Mohammed incidentally is employee number 1 of Apollo Hospital, Delhi. And he is the chauffeur for Dr. Reddy. And he said, you know, we're going to show to the surveyors on Monday that we provide excellent care. And he was an individual who had nothing to do with clinical care, nothing to do with patient care. And when he said that, well, I knew that, the team knew that we were going to be fine, because I think it had gone into the system. It had permeated right to everyone who was a part of the institution. And I think that's what it was. Yes, it was challenging. It was exciting. And all of us who were part of that team have some amazing memories of that 18 months journey from the first trip to our group to actually getting the accreditation.
Thank you, sir. The next question goes to Ms. Paula Wilson. The question is how you communicate to the general public the importance of accreditations like JCI and NABH to generate awareness in them.
That's a great question and a difficult question. The irony is, in all of the history, as I talked about in the United States and now around the globe as well, the patient engagement around quality and safety, I think, is something that we have not done well yet. The average patient is very familiar with their own doctor and what the doctor says to do in terms of their care and where to get the care. But it's amazing to me that in the United States today, after 70 years of accrediting hospitals, the average American has never heard of the Joint Commission and doesn't know or understand what accreditation is. I think that actually we have had a better experience internationally because of the nature of the work and how we work with organizations. The seal is prominent in many hospitals and it's much more obvious to patients, but it's a good question that I don't have a great answer to, because I think that it's still, patients are not aware enough of the challenges of safety and quality and make decisions about healthcare based on a lot of things, based on what their insurance will cover, based on the convenience of the location, based on their confidence in the physician. But we have not been, and by the way, in the United States, we've had several campaigns to engage patients, to do advertising and things like that, and with a low degree, with no real success. So I'm open to suggestions in that arena because it's really important.
Right, thank you, ma'am. The next question goes to Dr. Atul Kochar. Digital technologies in Indian healthcare are certainly witnessing huge adoptions due to the lockdown imposed to reduce the spread of COVID-19. What is the role of digital health standards in Indian scenario?
I think that's a very valid point. Telemedicine, when the COVID struck, the first thing which the Board of Governors in supersession of the MCI, they did was they gave to the nation a gift of the basic telemedicine standards, the guidelines. So this was a wonderful low-hanging fruit which everybody was practically, doing telemedicine, WhatsApp, other platforms, but there was no structure to it and practically it was illegal also. So what this guideline did was to legalize the options and with limited scope of the telemedicine content, but it became real. So with technology, we also realize comes lots of responsibility and the issues of the information, the content capturing, the privacy, security, what data is going to play, how it is going to be interoperable. And you would know that there are multiple technological standards. There's HL7, there's HMIS, there is IEEE, there FHIR, FHIR. So all these things have to be made palatable to the healthcare community because they're largely in the tech domain. So digital health standards of NABH takes into account all these existing tech standards and make them reach the common patient also and our doctors also. So what a digital health setup should look like, what all essentials criteria it should cover, and what are areas it should protect for the patient. So these standards address all these concerns, and they are going to bring so much clarity in this domain, because we have representation from practically everybody. We have from Bureau of Indian Standards, we have from WHO, we have Ministry of Health and Family Welfare, we have EHSRC, we have Electronic Health Records, the CDAC, the E-Sanjeevani project, and HL7, HMIS. In fact, to borrow Mr. Anish Chopra, the earlier Chief Technology Officer of President of USA, Mr. Barack Obama, is addressing us. So practically every organization is collaborating, and this is a one-off event which is expected to bring so much clarity into this domain. So this is something to be very hopeful for, and we expect to place that as early as middle of next month in public domain. There's so much good work it has been done in this segment. And beyond telemedicine, we also have to understand that digital health includes not only telemedicine, but the wearables. What about the issue of that iWatch, which most of us sport? What about the M-Health, the mobile health? So practically every aspect is taken care of, and a graded approach, a systems approach is being followed to give a basic document which can be built upon. So the foundation is very solid. And I personally am very hopeful as a member secretary also, because as a dermatologist, I would know, we all know that we have been doing these consultations since time immemorial, since the WhatsApp came into domain. But now we need more clarity. We need to borders and bring more substance to these foundations. So that's a small submission.
Thank you, sir. Moving on to the last question for the evening. It's addressed to Dr. Hari Prasad. The question is, it's been 15 years. How do you motivate your teams to work for accreditation year after year?
Interesting question, but I guess Anupam answered it in his answer. I mean, in the question that he answered. I think it's the excitement and the satisfaction that you get when you see a patient going home happy, healthy, and with a smile. I think that's the most important thing which keeps the patients motivated. And the second thing, it keeps the employees motivated and the staff motivated. And the second thing is, when it becomes a culture, you no longer need motivation. If we are doing the accreditation for the sake of accreditation, then it comes once in 3 years. So you do an activity for a couple of months before that, and then you're done with it and you forget about it. But once it becomes a culture, then you're on it on a daily basis and it becomes a part of your routine. So I guess over the last 15 years, it's become a part of the routine for all of us. And I don't think we need a special motivation to prepare or to get ready for a survey. It is one of the things which happens at regular intervals at Apollo Hospitals. And I think that should be the attitude of any organization which is going in for accreditation, because that's the most important part of it. The certification is less important, but adherence to the standards during the rest of the period is more important.
Thank you, sir. So rest of the questions would be addressed by sending an email to their specific email IDs. We are closing the question answer rounds for the evening. Thank you may be a very small word for the contribution of each and every healthcare and related professional who have made this day possible. 15 years is a long time and definitely many more to go. Before logging out, I would like to request you to please send us your valuable feedback on our email ID, which is patientsft@gmail.com. On behalf of Apollo Hospitals Group, I thank all of you for joining us today evening and would like to express my heartfelt gratitude to all the speakers for this wonderful session. I would also like to thank Sanofi and Roche for sponsoring this event. Kindly download our app, International Health Declaration, and also let us know if you would like to be a member of our Patient Safety Club. Thank you once again. Have a very good evening. Stay healthy, stay safe. Namaste.
And just first, one last thing before you go, we are going to be organizing series of events. We're going to get a lot of individuals who are real experts globally come in and address specific issues through panel discussion.